Natera is a leader in genetic testing, applying cutting-edge technology in the fields of cancer, women's health, and organ health. And with me is CEO Steve Chapman to tell us more about what Natera is doing right now to fight some of the most challenging diseases of our time. Welcome, Steve.
Hi, Jane. Thanks for having me.
Yeah. So you've made your mark in women's health, specifically non-invasive prenatal testing. Now, many women, myself included, got amniocentesis. So I remember going through that very, very well. How does your test differ from that?
Yeah, so we've developed a technology that can detect extremely tiny quantities of DNA from a simple blood draw, as small as one molecule. So in many ways, you no longer have to go get an invasive procedure as a first step. You can now get a screening test using our laboratory that can tell you the risk to your pregnancy, and only those that are at extremely high risk now need to proceed and get a more invasive procedure.
Now, Steve, recently there was a Panorama Smart study that was presented for maternal fetal medicine that showed that your test is highly effective. So can you go into some detail about what that test showed?
Yeah, so when you're dealing with complex genetic disorders and the testing like we run with Panorama, it's really important to have peer-reviewed publications. Now, we sponsored a 20,000 patient, 5-year prospective clinical trial called the SMART study. And the results were recently released at the Society for Maternal Fetal Medicine conference earlier in February. And we found that the test performed as expected with very high accuracy in detecting severe genetic abnormalities early in pregnancy. Now, not only that, we also looked at a lesser well-known disorder called 22q microdeletion or DeGeorge syndrome. And what we found was that it was common in pregnancy at about 1 in 1,500 pregnancies. And we were also able to detect that with very high accuracy. And we think that that can have a very meaningful impact on clinical guidelines and the way pregnancies are managed in the future. Mm-hmm. So we expect the paper to be published later this year, and we look forward to that happening.
Yeah. Now, your technology can also be applied to other diseases as well. And recently you were telling me you have some groundbreaking work on cancer. So
right.
Explain that.
Yeah, so the same technology that we've used to detect genetic abnormalities very early in pregnancy, where we're now the market leader, we've applied to look at what's called circulating tumor DNA. So as cancer cells in the body die, they release fragments of DNA into the bloodstream. And now, rather than doing a biopsy, what we can do is from a simple blood draw, after you've been diagnosed with cancer, we can detect cancer recurrence. And we've shown our technology works extremely well. We've published on over 2,000 patients. We have 8 peer-reviewed publications where we can detect cancer recurrence up to 8 months sooner than what you can normally do with imaging. So it's a very powerful technology, and we think can make a significant impact on the way cancer patients are treated.
Well, absolutely. I mean, that could be a game changer. Can these tests be done at home?
Yeah, so because of the non-invasive nature of the testing, where you just need a simple blood draw, this actually fits really nicely with, I think people having limitations on being able to go to physician practices and, working from home. We can now dispatch a courier for any of our businesses, whether it's prenatal, whether it's oncology, whether it's organ health, and we can do a simple blood draw just from your home. Mm-hmm. So the non-invasive nature of the test really allows for that.
Yeah. So, and then finally, Steve, I'm just curious, since you're kind of on the front lines of genetic testing and this field, what do you see on the horizon?
Yeah. So, over the last 10 to 15 years, the cost of doing DNA sequencing has really come down significantly. And that's allowed a lot of innovation. And so we have new tests that are coming out in women's health, in organ health, in oncology, and we're really expanding the clinical utility of genetic testing. So we think that's just going to continue, particularly in the area of cancer, where there's a lot of patients that need help. And that's what motivates us at Natera is really helping those patients.
Okay, well, the science behind this is fascinating and transformative. And I think we've all learned lately how important science is. So thank you so much, Steve, for joining us and explaining Natera.
Great. Thank you, Jane.